Does anybody know what a Lamassu is? No, I didn't either. Good. I'll show you pictures of one. I have no disclosures related to this topic, but everything I'm talking about is not FDA approved, okay? Just to make that clear, but no other issues of disclosures. So as I mentioned to you, I get these topics from looking through the headlines. I look through the stock exchanges. I look through what's happening in Maryland or Virginia. And xenotransplantation, as I'll show you, is probably the most recent consideration of advancing transplantation medicine. The xenos part comes from the Greek word that means foreign or strange. I'll show you pictures of those. And here's what the FDA says about xeno. It's any procedure that involves the transplantation, implementation, or infusion into a human recipient of either live cells, tissues, organs from a non-human animal source, or, interesting, and that's not what I'm going to talk about today, human body fluids, cells, tissues, or organs that have had ex vivo contact with live non-human animal cells. So taking the human out, exposing it to the animal, and then putting it back in the human. So here are objectives. I'm only going to do two. Dr. Sulmasy will do the third. We're going to talk the use of genetically modified porcine organs for use in human transplants. I'm going to show you three different models of xenotransplantation that are currently used in the United States for kidney and heart transplants into human recipients. Then I'm going to ask Dr. Sulmasy to come up and talk about the medical issues and ethical issues of each of these three models. And you'll see they're very different from certainly a medical as well as an ethical. So I have two case presentations. If you read the newspapers or look at CNN, you should recognize these. The first is a 45-year-old male who was injured in a traumatic accident and was subsequently declared brain dead. The transplant center that he was at considered an organ donation, individual organ donation, but no successful placement was found. And so the family very much wanted to donate some components, so they donated the entire body to pursue an experimental xenograft transplantation. So the patient was now the experimental person, was transferred to an isolation ICU. The patient, and now the recipient, got a genetically modified pig kidney placed surgically. And the recipient and this transplanted kidney were studied for 54 hours by a protocol, well-defined protocol. I have some pictures of the surgery. This was not, and you'll see it's different than the second one I'm going to show you. They put the xenograft on the thigh so they could have access to it. And they cannulated both the xenograft ureter and the kidneys, native kidney ureters. So again, that will be different when I get to the second kind. And there's a picture of this kidney, pig kidney, sitting on the outside. Now contrast this one that happens closer to home. This is a 58-year-old male with end-stage cardiac disease, admitted with heart failure. And I quoted this because that's one of the things I'm sure Dr. Sulmasy will comment on. He was not a candidate for a traditional heart transplant because his pre-existing peripheral vascular disease and complications with internal bleeding. So he got a pig heart. This is a live human who got a mutated pig heart. His clinical course was followed per protocol with immunosuppression, bacteria cultures, porcine pathogens, and he survived for 61 days. This is a picture of him before his transplant up in the ICU at the hospital. So what's similar about these two cases? Think about this. What's different? And do either of these cases concern you about the ethics of either donation or experimentation or selection for patients who need and can get a transplant? So this is one of the first published papers going back to the kidney model. This is not from the patient I showed you at New York. This is from UAB. This was published in the Journal of Transplantation, I think, American Journal of Transplantation, December of 21, so not so far away. To bring this home, guess where these pigs come from? Right here in Virginia, at Blacksburg, Virginia. There's a picture in the top right of the facility, $100 million pig organ facility. Now, many of you know I'm from Iowa, and we raise pigs all the time. Our pigs don't look like this, and they certainly don't live in a $100 million home. But right here in Virginia at Blacksburg is where all these pigs are coming from. All the experiments and cases I'm describing today use this as the source. So before I go into that, how did Luxon come up with this, and why is he talking about this? Who knows what this is? Vervalis is here. I'm sure you know, Joe. Don't spoil it. So this is a chimera, word we all know now. It starts off often as a lion in the head. This one has a goat body, pretty typical. And if you look at the tail, it's often as a snake head on the end of the tail. So a chimera, word we all know, I hope. But my title was a Lamassu. And so this is a picture of that. It's the International Xenotransplantation Association symbol. Did that show? How do I get rid of that? There we go. It's usually now a little bit different. These are heads of a male, often with wings and different body parts, but the head is usually a male, meaning a person. And so that's closer to what we're doing, isn't it? We're using the main body of a human and putting in animal parts. We've had these concepts for thousands and thousands of years. I picked out just a couple of pictures. On the left there, you can see a Mesopotamia version. Again, the human head, beard, but has wings. Everybody wants to fly. I guess that was, early on. Has a tail. Look at the claws on this animal, and then horns as well. And then on the right, you can see a picture of, again, a human-headed bull. This is dating from about 800 years before the birth of Christ. Those statues are now in the Louvre. So it's been around for a long time. The idea of using pigs has been around for a long time. Donor pigs have been considered to use their skin, as you can see at the top, kidney failure, and diabetes treatment for where we put the islets in. All those concepts have been tried, but you haven't heard much about them, have you? And I'll give you some more history. So the first attempt that I could find was in 1902. I was, believe it or not alive back then. Dr. Mitchell maybe can comment. But a guy put a pig kidney into a human, put it onto his arm. Why the arm? The vascular connections were easier. 1902. Same, a French gentleman put portions of rabbit kidney into a human child's kidney. Those didn't work very well. In 1906, Jobelet put a pig and a goat kidney into humans in separate experiments. Now, fast forward to the 60s, and we discovered, well, that didn't work so well. We'll try chimpanzees, non-human primates. And one put a kidney into a human, and it lived 9 months. Wow, pretty progressive. And then at the bottom, of course, is Tom Starzl, who was putting baboon livers into humans. You can see the survival rate there. But then what happened? Kind of went away, didn't it? Partly because of things I've outlined on this slide. There were some pretty goofy ones. We used to transfuse blood from various animal species into patients, hoping that whatever feature the animal had would then take over the human. So that if you needed to be more aggressive, you need more passive at that. We tried skin grafts. Interesting, a frog skin was used. You got to have a lot of frogs to do much benefit. But the one that I thought was the most bizarre and probably turned things off is another French guy, advocated in the 20s. Remember the roaring 20s? Yes. Transplantation of slices of a chimpanzee testis into old men, I'm paying attention, whose zest for life was deteriorating, believing that these hormones might rejuvenate the patient. That also didn't take off a lot, as you might guess. There's my chimpanzees. Now up to the current time, and there are currently 5 cases that this has worked out. This was the first that was really published well, 2021, so about 2 years ago. This is from UAB, world's first pig to human transplant. And you can read those first things. This was the published study, peer-reviewed, a modified pig kidney into the body of a brain-dead human. So again, that's this different case. When Dr. Sulmasy gets up, talks about the Maryland cases, I'm sure those will be pointed out. This pig was special, and I'll describe why he was special. Besides his dress, I'll show you his costume in a minute. He had to just test about the compatibility. The UAB came up with that. And then we came up with a protocol to help establish brain death as a viable preclinical human model. Again, this recipient was brain dead, and the family consented to donate his whole body to science, if you will. The second one that happened not far after that was up at New York. Again, a test pig kidney came into a human patient. This was done by Bob Montgomery. Bob used to be at Hopkins. He is really a rebel. He's married to a opera singer. Some of you have met Bob. He raises llamas in the spare time. He was our first Goody professor because he helped with the Goody family. So he's now up in New York, and he's putting in again, a test pig kidney into a brain dead donor. There's a picture of Bob, and again, releasing this second successful. So they did 2 very quickly into these, and these are experiments, not designed to prolong life. The recipient is a patient who's brain dead. So I have some comments on this pig, naturally. So this is a special pig that comes from Virginia. The pig has been modified by changing the genes, and I'll show you some of those. They knocked out specific genes. The New York crowd also hooked up a thymus from the pig to put into and these are all experimental ideas. They also put the kidney into outside the body, hooked it up to the femoral vein. They left the kidneys of the native kidneys in, and then measured urine production from both. Let's see why they put that in. Oh, here's another publication going over all that. Look at all the people that are on there. This is the first publication. I've shown you this before. This is back to the UAB. So at UAB, they had something called the Parsons model. I had to figure out who that was. This is the donor of the body, Jim Parsons. And again, to go over this is somebody who's brain dead, and they put 2 kidneys, not 1, but 2 kidneys that were modified, put it in. They monitored for hyperacute rejection, and the kidneys remained viable. Their experiment was 77 hours long, and the experiment was terminated. So this is Jim Parsons. He was an avid motorcyclist, liked to ride ATVs, and that ultimately caused his death because he was in an accident and he was declared brain dead. Here's a picture of his family after, you can see all their protective gear after they rode their ATVs up the top. So again, a person donating their entire body to science. Now I have to tell you a little bit about the pigs. First of all, My wife designed this picture of the pigs. You can see a pig up there with the red hair. This was a 13-month-old, 350-pound pig. How was the pig modified? They got rid of the things that the human doesn't like. So they don't express, pigs in general don't express the ABO blood types on RBCs, so they're universal donors. But these had 10 specific genetic modifications that we picked up. First of all, we got rid of some of the complement inhibitor genes. We got rid of anticoagulant genes, immunomodulatory genes, got rid of some pig carbohydrate genes. And interestingly, they got rid of the pig growth hormone receptor gene. They were worried that the organs would start to grow if we didn't get rid of that. And as I'll show you some pictures of the surgery, that doesn't work very well. So these are these genetically modified pigs. Just like any other transplant, we study histocompatibility. And so they set up this very elaborate system to make sure that the particular pig and the particular recipient didn't have anything that was going to make this a disaster. And so they ran serum from each of those. You don't need to worry about those in the sense that there weren't any interactions. So it was a good match, just like we do with regular kidneys. So this protocol was to separate and biopsy the kidneys pre-transplant. They transplanted each kidney separately. They did two. They discovered that human ureters are smaller than pigs. The pig kidney is actually quite soft, and it has a very thin capsule. If any of you biopsied a kidney, and I have done a couple by mistake, human capsules are pretty tight, tough. These are, so the surgeons had to work a little bit. And they put the different ureters hooked up. And then they had the immunosuppression. So look at these. If you do transplants, you'll see rituximab. You've all heard of that. Dr. Welton uses it all the time. Tacrolimus, same thing. MMF, same thing, and some methylprednisolone. Pretty standard anti-human rejection medications that they used. I put this slide in to look at all the different things that have to happen in this experiment. So pre-transplant, which takes about 19 hours, shown there in the yellow, they have to find the recipient, make sure that the family's consented. And this protocol, they take out the native kidneys. So the patient's anephric. Then they find the right pig and they put in the pig organs. And then they put the recipient with the new pig organs into the ICU in their special ICU where it's germ-free. You can see all the different things that have to go on during this experiment. It's truly an experiment, well-defined protocol, approved by the institution and by the FDA, interestingly. Here's some pictures of this particular one. So they put the right one in first, and you can see after a little while it pinks right back up. If you look at the timestamps on there, boy, it didn't take long, did it? They opened the vessels at 1538, and by a minute later, it's pinked up. The right xenograph output there, you can see there at the bottom as well, that it started to make some urine. So just like in a human organ transplant, it's important to know how long the donor kidneys were warm ischemia. You can see the timing there. Cold ischemia. Again, you notice the second kidney they put in took a little bit longer because they're still trying to fiddle around with this very sensitive capsule, thin capsule in the ureters. The right kidney, the first one that went in, made urine within 23 minutes. That's pretty standard. But interestingly, the serum creatinine of the recipient didn't really change. Then I'll show you some pictures of what went wrong on these biopsies. So did the kidneys function, the transplanted kidneys function? If you look at the top, the one that's looking at urine output, the top little line in green, that's the right kidney, worked really well. The left kidney, not so good. It didn't quite catch on. And then if you looked at the bottom slide there, you can see that the BUN, the creatinine, really didn't change much. So the kidney's alive. It's making some urine, but maybe not high quality urine. So what happened? Because they designed the pig donor kidneys to be specifically not so antigenic, there was no hyperacute rejection. That's what had gotten previous attempts at this. But when you started to biopsy the kidneys, there's clear evidence of microthrombi, and in some, so they got ATN, basically. And some of them, you can see, I circled, I guess, in the second row there. A lot of the glomerulus is just filled with fibrin. So the kidney is basically not functional anymore because it's been attacked by microthrombi. So how did it turn out? The decedent I'm talking about, remember, he's brain dead already, developed severe multi-organ system failure, went into coagulopathy, DIC. They kept him as part of their protocol alive with fluids and pressors, but his DIC, that was not allowed to do, so he basically exsanguinated. The good news was that they looked to see if there was any pig viruses and zoonotics in there. The answer was they didn't find any. So, published, sounds pretty good, an experiment, but naturally, some people thought this was not such a hot idea. This is a letter to the editor to the journal where I just showed you that, from some guys up in Boston at Harvard. And so what did they say? I thought it was really interesting. This is from their article, their letter to the editor. So they commented on the microangiopathy on that biopsy and the fact that the creatinine clearance didn't improve needs to be addressed. In other words, it's screwed up, didn't happen. The lesions, second point, the lesions on the repeated biopsies showed that the glomeruli were basically thrombosed off. And these are unlikely to antibody, but more likely to the fact that the recipient was hypercoagulable. And then look at the third one. I thought this was very bold. Quit doing these on brain dead patients. Instead, pick a dialysis-dependent patient, a live patient who's otherwise stable, has no living donor options, and on the bottom of the waiting list, and put the experimental pig kidney into him or her. And I'm sure Dr. Sulmasy will comment on that. Again, not an experiment, but an attempt in somebody else who's otherwise pretty healthy, given they have end-stage renal disease, with an experiment. So the second part that I'm going to talk about is closer to home. It's about 90 minutes, depending on when you go up there. And that's the University of Maryland is putting in pig hearts into live end-stage cardiovascular patients. So they've done 2, and let me just show you those again. So this is one of the cases that I described to you. This is Lawrence Fawcett, and he got the second heart experiment, not really experiment, transplant. He, again, as I read you that quote from Maryland, was ineligible for a traditional heart transplant. So again, they put in a modified heart, took obviously his out, put this in. The picture I have here is about a month afterwards, and the press release says, doctors say they see no signs of rejection or infection. He's doing well, he's in rehab. And there's the picture that they provided. When I originally wrote these slides, he was doing okay. Here's him before the surgery with his wife. And here's the quote, and I think this is really important, and again, dumping it on Dr. Sulmasy. My only real hope left is to go with the pig heart, the xenotransplant. And this is his quote a few days before. Well, after I made these slides and I went to Boston to be a liver doc, this came out in CNN November 1st, and Mr. Fawcett died. I don't know why, but they said they saw no signs of rejection or infection, but he died. And so the average lifespan of these experiments is measured in weeks, not years or months. So that's my conclusion and end of my component. Let me introduce, good, the slide up. So the real reason you came is hear Dr. Sulmasy talk. He's a member of our general internal medicine program, but more importantly, he's a senior research scholar in the Hellegers Professor of Biomedical Ethics. You can see his other titles down there, but he's an expert on the ethics, and I thought he would be perfect to talk about the different cases, some on a brain-dead person, some in a brain-dead person where we leave the kidneys in, all well-defined, and then the two from Maryland where we take an alive person and try to decide how to preserve their life. And so with that, Dan, if you'd come up, I'll turn it over to you. We will have questions for both of us, mostly for him, from Dr. Roberts. The testis question, Dr. I've already checked that out. Dr. Mitchell, we're not doing that.
Thanks for the gracious introduction and for setting the stage, talking about the scientific and medical issues here. And I am going to try to talk a bit about the ethics. It's also a topic that I, like Dr. Luxon, didn't know an awful lot about. So it was a chance for me to learn a little bit more for this talk as well. I'm going to talk about three sets of questions about xenotransplantation. One is questions that you might have about the intrinsic morality of putting organs from animals into human beings. Second, a set of questions that Dr. Luxon didn't talk about is questions about animal ethics and the treatment of the pigs that are the donors for this or other animals. And lastly, questions which Dr. Luxon did raise significantly about research ethics. So the questions about intrinsic morality are these. And maybe you share them, at least a little bit of squeamishness about this. Is there something morally wrong about surgically implanting animal parts into human beings? Second question would be, does it matter what part? And the third is about, as Dr. Luxon suggested, what is a chimera? What's the morality of creating a human animal chimera? So with respect to the first question, is it morally wrong to surgically implant animal parts into humans? You might have a question about whether this sort of in some ways violates norms of nature, right? We're not meant to have parts of other animals inside our bodies. But I think if you think about it a little bit more, probably the primary impulse of any natural living thing is to seek its own persistence, right? This is one of the driving forces of all life. And so there's a way in which the patients who want to live and want to go on and have will do what's necessary in some ways, provided other moral norms are not broken, is a strong natural impulse. And I think that in some ways, this is a natural impulse and one that we can be morally pleased with. This is a part of the ways in which we pledge to help patients, and we can help them to do that by putting sometimes devices in. Is this simply a biological LVAD? To put a pig heart into a human being. And there's another way in which we've been doing this for years, right? We use animal hormones all the time, bovine thyroid extract. We use equine estrogens, right, for patients for years. And we've also been putting porcine valves into human beings for years, and people don't seem to really think there's a problem with any of that. So we've already been doing some use of animals for human beings, and obviously we make all kinds of use of animals simply by eating them if we're not vegetarians, and by using them for experiments, and also part of their parts, things we've been doing for quite some time. So I don't think there's really an intrinsic moral problem with putting an animal organ into a human being. There are, and you should be aware of this, potential religious objections. I don't think Christianity has any intrinsic objections to this, but in Judaism and Islam, there have been questions raised largely due to dietary laws and restrictions. So for in the Jewish literature, there have been questions about whether this violates kosher prohibitions on the uncleanliness of pork, because these are all being used largely for reasons, as I understand, of size. Actually, that the size of the organs from pigs is actually better for putting these into human beings. But for some pious Jews have raised questions about whether this violates kosher prohibitions. On the other hand, certain Jewish scholars have said there is a stronger, perhaps, mandate to preserve life. And while there have been, and I've read opinions on both sides in the Jewish medical ethics literature, I think the preponderance would say that the duty to preserve life actually in this case would outweigh the kosher restrictions on the uncleanness of pork, although they would rather we find other animals that would satisfy this. Similarly, in Islam, there's a halal prohibition on the uncleanness of pork. Some questions have also been raised about human dignity being violated by putting animal parts, animal organs into human beings. But Islam has conditions of necessity and of public interest, both of which, at least in some discourse, have said that this would be something that could be acceptable to a pious Muslim. Although there have been, to the best of my knowledge, no fatwa about this, and no Islamic juridical councils in any country have ruled officially on it. So it's a matter of debate in both communities. So if there's no prohibition on this from an intrinsic point of view, does it matter what parts you're putting in, right? So heart valves are one thing, right? Kidneys and livers may be another. People have a stronger sensitivity maybe about hearts, but a lot of people would stop if we said we were going to put a pig thalamus into a into a human brain, or a pig cerebellum into a human brain. Obviously, nothing like that is on the horizon yet, but something that approaches more to our central nervous system and are sort of closer to our personal identity has raised questions for people. Particularly with respect to the question of human-animal chimeras. Now, it is not clear what actually constitutes a chimera. There's a way in which putting anything, as the definition that Dr. Luxon presented to you, any tissue from an animal into a human being is in some ways a chimera. But there's there are concerns, I think, when we do this, about whether we are, in fact, doing something that violates the integrity of human persons or human dignity. So there are experiments that are being done right now in embryos, right, of putting, up to, large numbers of cells from other animals into human embryos, or vice versa. This has raised troubling questions for people. In part, I think it's sort of semi-quantitative, right? If it gets to 50-50, you're sort of an embryo that's half porcine, half human, I think people would have significant kinds of worries. But at least in terms of transplant, I don't think we have those kinds of worries, because I don't think single organs or parts would meet that kind of threshold for worry that we are in some ways disrupting the integrity of the human person, or in some ways confronting human dignity or assaulting human dignity. There are questions that have been raised actually about animal ethics with respect to this. So we're all certainly concerned about, as physicians, helping human beings, but we want to do so in ways that are respectful of the rest of the animal world. And there are some questions about the treatment of the animals. They have to be genetically modified, as Dr. Luxon suggested, and less than 1% of the animal embryos survive both the knock-in and knock-out genetic manipulations that are done to the embryos. It is also very interesting, it's been raised as a question that all of this is commercial. So the folks in Virginia, in rural Virginia, who are raising these are doing it in secret. They're not sharing their data about this because they want to be able to make money on it. And there are concerns that this actually then leads other people who are trying to do experiments to replicate the mistakes that were made by other persons, because there's not a sharing of data, and this leads to the death of more animals than might be necessary. The animals, in order to be preserved from infections, and there are great worries about porcine retroviruses, for instance, getting into human beings. They have to be raised in isolation, which raises some concerns, and they have to undergo frequent testing. So there are questions about the treatment of the animals that have been raised. But of course, we're always balancing this, aren't we, against human need. And I think that one can, despite those sorts of issues, make a case that one does the best one can for treating the animals in as humane and painless a way as possible. But the needs eventually for all those human beings who cannot get organs now, which is the great promise of this, right? So many people on waiting lists that can't get organs. Those of you who are in our intensive care unit know how many people are waiting for livers, right? That there could be other sources of these organs would be a good thing. And I think it's only the most radical animal rights activists who would say we shouldn't do this because we're maltreating animals only for the sake of human beings. And I think it also has to be balanced against the alternative of human donation. There are ethical questions that are raised about brain death that are new, and I know that Dr. Roberts has talked to you about that in this setting within the last year. So there are questions about brain death. There are questions about donation after circulatory determination of death as well, ethical questions that are raised there. And if we could, in fact, find ways to use animal organs, it might make the transplant world very happy that they would have a supply of organs. Patients would be satisfied that they would be able to get the organs, and we might actually do an end around of some of the human ethics issues about the treatment of human organ donors. But I think, as Dr. Luxon suggested, that the real issues here relate to research ethics. So, for instance, the kidney transplants that Dr. Luxon was talking about have been done on brain-dead human bodies. So one of the questions is how long one should continue to experiment in someone who has been declared brain dead. I mean, people who certainly donate cadavers, their bodies as cadavers for science, but this is donating your body to be kept on a ventilator, sometimes using pressors, certainly other sorts of supports, and to be then experimented upon as a sort of living receptacle for these. So there are questions of how long to go on. The first protocol was 52 hours, and then I heard at the NHLBI at a conference in the spring, oh, we're never going to go beyond a week, and yet the latest from just in August was that at NYU they went 32 days. So someone's declared brain dead, and they're just experimenting to see how long they can keep the thing going for 32 days. How do we consent to this? Do people, family members, really understand what they're consenting to when this is done? I think there are questions about the quality of consent that can be raised, and then questions about how to regulate this. Right? So what category of regulation does experimentation on a brain dead body fall into? It is no longer human subjects research, right? Because the human subject has now been declared to be dead. It's not animal research, although it involves an animal as the donor, and it's not really organ donation. So we're not using the person who is the body of the person who is declared brain dead as an organ donor. So it's unclear how this would even be regulated, but people are going ahead and doing it anyway. Second, a set of questions regards environmental risk of zoonotic infections. Pigs have viruses that that they carry within their own bodies and within their own genomes that are not, in fact, pathogenic to the pigs, but could be, with just one or two small mutations, become infectious to human beings. And so there are worries about the possibilities, and this is not being done in a very highly secured, I mean, somewhat a secured environment, but not the kinds of security against environmental pathogens leaking from the intensive care units where these patients are being treated. And so there are worries about this, and worries about the fact that there are no national or international regulations about any of this. So there are those sorts of risks that I'm not sure have been fully assessed. And some people have raised questions about equity for this, and you almost got that sort of sense in the kind of language that was being used in some of the presentations that Dr. Luxon made about what patients were saying. Underserved patients, right, who are getting the short end of the stick to begin with, are the most likely people who are going to be having a late presentation, be declared not candidates for an actual human organ transplant, and maybe then selected as the people who would have experimental pig hearts rather than human hearts or other organs, and that would potentially exacerbate already existing disparities in healthcare. So those questions have been raised. But lastly, and perhaps most importantly, I think the question that I think should be raised is, should we be doing this in human beings yet? Right? There is always among surgeons the rush to be the first to do it, right? To get the paper out, and you saw the publicity from UAB first, right? Is always going to get you the publicity and maybe get you more grant money and donations. But and we want to help people, but we've also got to temper this against the fact that the risks to this are very great. At least for the 2 human heart transplants have been done. Patients haven't lived more than 6 weeks. We don't know in either case exactly why it is that they died. So the benefits are not really that great. I'm not sure the quality of life of these individuals was very great for those 6 weeks. And if you just go back to simply the Nuremberg Code, one of the bedrock principles is human experiments cannot be done until sufficient animal experimentation has been done, and I'm not quite sure we're at that point yet. I also have worries about informed consent. Again, the quotes you heard from the patient that Dr. Luxon described, "It's my only hope." Was this person actually subject to what is sometimes called the therapeutic misconception of thinking that this was actually going to be something that would be an approved benefit that would actually help him, rather than being signed up as an experimental subject in something from which he was actually likely, very likely to die, and that the real reason to do it would be to help other persons altruistically. So I have concerns about the quality of informed consent for this kind of research. And I also have concerns about people who have sort of cast this as palliative. Well, we're actually helping this person at the end of their life. I don't think the quality of life of people who never make it out of the intensive care unit and die within in 6 weeks could be actually construed as palliative. So I do have worries, not about the intrinsic morality of doing this, and I hope someday it will be done, but I have worries about whether this is the right time to be doing this in human beings, or we're jumping the gun for perhaps reasons that are less than noble. So with that, I'll invite Dr. Luxon back up to the podium, and we'll entertain questions about the science and the ethics of xenotransplantation.